So, hello everybody. My name's Amanda, obviously. So I work in the outpatient retail pharmacy. And let's see if my slide, there we go. I've worked with ProHealth Care for about almost a year now, so not very long. Before that, I actually had zero experience working in a pharmacy. I was a preschool teacher before this, so I worked with kids for about 6 years prior. The way I got introduced to ProHealth Care actually is because of the pandemic. Working in childcare was just really it was really challenging. My classroom kept getting shut down because of COVID reasons, and so I was not providing for my family because, I don't get paid when my classroom is shut down. So I had a family member who worked for ProHealth Care, and she introduced me to this job. They had a lot of openings, and I, got to choose between pharmacy and radiology, and I chose pharmacy. I love the atmosphere. The outpatient pharmacy, I don't know if you guys ever been to like a Walgreens or a CVS. That's what we do here. Just our location is inside the hospital. So we're pretty small. We're smaller than a Walgreens, but we do kind of function the same way. My background is, I have a high school diploma. I was in the military for about 6 years. And then that's when I started working. After that, I started working in childcare. So I have some random college courses in early childhood education, but really, I don't have a big fancy pharmacy degree or anything. So it's pretty nice that they offer jobs like this without any, real experience. But I would say a day in the life of a pharmacy technician on the outpatient side. I go to work, I open up the pharmacy, turn on all the computers. I will start filling scripts once we're opened. I will receive a bunch of prescriptions from our computer system, and I just start getting those filled. We have a little rack that we hang them up in when we're finished checking them. So once I fill the medications, our pharmacist checks the medications, make sure everything looks good, everything is the correct medication. And then they'll hang it up, and we wait for people to come pick up their meds. We do help keep the pharmacist on task. We only have one pharmacist working in our location, so 2 technicians and 1 pharmacist. So our pharmacist is busy throughout the entire day. So we kind of help organize and prioritize certain medications on who, whether we know the person is coming in soon, or if we have to go deliver a medication to somebody here in the hospital, we help organize the pharmacist so that they can, get the meds that are higher priority done first. So we also submit and receive medication order. We have a supplier that we order all of our medications from, and it's the technician's job to order from that website so that we can get the meds that we need in the next day. So we'll submit that order, and then the next day when they do come in, we process that order. After that, it's around lunchtime, so I go to lunch. We do get like a 30-minute break to go eat our lunch. And then we'll come back and we'll fill more medications. It says like fill discharge medication. So that's one of our programs is in the hospital. When a patient is ready to go home, the doctor usually sends medications home with that patient. So it's our job to fill those and deliver them to that patient's room. So we get a lot of doctor prescriptions, and we do have to, sometimes they're handwritten, and we have to kind of try to decipher because doctors have terrible handwriting. But we do our best to try to like decipher that. We ask the doctors questions if we have any questions. We go deliver them when we're done. We complete specialty orders. I'll kind of get more into that in a couple slides here. At the end of the day, we just close up the pharmacy and we go home and do it all again tomorrow. So I have favorites and least favorite parts of my job. The favorite parts of my job are helping patients afford their medications. Insurance is a big thing in the pharmacy world. A lot of people don't just, pay for their medications out of their own pockets. They have medication insurance. So we have to find their medication insurance, process their prescription through insurance. Sometimes insurance makes it really expensive. Sometimes the doctor prescribes medications that are really expensive. So there's lots of tips and tricks that you can do to help bring that cost down for them, and the patient's usually really appreciative of that. So that's a really good feeling. I like to see patients not come back anymore. Like, as much as I love seeing people and interacting with people, I love it when a patient doesn't need the therapy that they're on anymore, that they're healed, that they're all better. We had a patient who was taking medication for infertility. She was trying to have a baby, and she was taking she got prescribed medications to help with that. And she came in one day and said that, like, this is my last dose because I'm pregnant and she's having a baby. And we were all so excited. It gives me goosebumps talking about it because it's a really good thing that, like, she's like, I'm never going to see you guys again because it worked, So we're like, yay, but, kind of sad because we don't see her anymore. But it was a good feeling. I also like creating close work relationships because I work with some awesome people. She's pretty great. So we work with all sorts of people here at the hospital. My least favorite things are fighting insurance companies. So sometimes insurance companies won't cover a medication, and so we have to go through hoops to call them and do certain paperwork for them to approve medications. It's this long journey. It's kind of tedious, but worth it. Medication back orders are something that are really challenging for us when we can't get in a medication because the companies aren't making enough of it. We have to wait kind of a long time to get that in. So patients will be waiting for their medication for a little while before we can get in that type of medication. One struggle is remembering patients are going through the hardest parts of their life. So working in outpatient, you kind of have to have a tough skin because people are going through some really hard times, and you just have to remember that. Sometimes they forget their manners. Sometimes they forget to be kind and understanding. So the best thing you can do is keep a calm tone of voice, be very empathetic, very understanding that they're, probably just coming through a really hard part of life. So the equipment that we use, we have a thing called an Omnicell. All of our higher controlled medications are kept in an Omnicell. It's kind of a beast to work with if you're not used to it, but that's how we pull out and keep track of our controlled medication. We do lots of stuff. We use electric stirrers. We use hot plates. We use measuring machines in order to compound medication. We, home make some of our medications. And we also use like a register because we're an outpatient pharmacy. We have a cash register. We use computers and all that kind of stuff in our pharmacy. Our schedule looks pretty consistent. Other retail pharmacies like Walgreens or CVS don't usually have as a consistent schedule as we do, but we're Monday through Friday, 8:30 to 5, that's our opening shift. We're open until 7 p.m., so we have a closing tech and an opening tech. Our opening shift is 8:30 to 5. Our closing shift is 10:30 a.m. to 7 p.m., and we rotate every week, me and the other technicians. So this week I'm closing. Next week I'm going to be opening. So we get a 30-minute lunch break. We do have to work one weekend because we are open on weekends, but all of our technicians in the retail pharmacy side, we rotate those weekends. So all of our locations will rotate. So it's about every 6 weeks that I have to work a weekend. And we do receive comp days during that shift. So if I work Saturday and Sunday, I'll probably have the Friday before and like the Monday after off. And then we're closed on major holidays. The types of patients that we see, everybody, from little newborn infants who need vitamin D drops, or I was filling meds for a 98-year-old patient the other day. So, and they walked in. They drove themselves to the pharmacy. They walked in. They knew exactly what they needed. And I was like, what's the secret, you know? So we, like I said, deal with patients who are going through hard times. We have patients who, you know, just received a transplant. The stories you hear are incredible, but we, all ages, all ethnicities, all kinds of backgrounds, we help everybody. Other healthcare professionals I work with, again, everybody in this hospital we interact with pretty much. Inpatient pharmacists, those are the ones on the floors. They're the ones who come into your hospital room and tell you about all the medications. We work with them the most. We do work with other retail pharmacies. So if somebody has a medication at Walgreens and they decide they want us to have or fill their medication, we call Walgreens, we call CVS, we call Walmart. We talk to doctors a lot too, nurses. We all are on the same team to get the patient what they need to go home with. Case managers, if somebody needs help affording their medications, we deal with case managers and coordinators. Coordinators are also people who run different programs, which I'll get into. Our programs are our clozapine program. They're for psychiatric medications. A lot of the time they go to we have a coordinator who delivers these medications that we fill to a psychiatric hospital, so they help out with that. Billy, my other pharmacy tech, she is in charge of the clozapine program. I'm in charge of the fire department program. That is a program we run out of our pharmacy where I stock every medication that is in every ambulance in the Waukesha County area, pretty much. So if you ever, hopefully not, if you ever are riding in an ambulance, I put those meds there. Not specifically, but I supplied the medications for that fire department. We do our meds to beds program, which I mentioned before. When a patient's getting discharged, we fill those medications that they need to take home. We deliver it to their hospital bed. Usually they're, you know, in the middle of like getting ready to leave. So we try to get it to them as quickly as possible because, you know, nobody likes to stay in the hospital. They want to go home. We try to be as quick as possible to get them home. And then we have a home infusion team who does supply medications that are actually administered in people's homes. I don't know, I'm not too familiar with this because it's actually located in our inpatient pharmacy. So I don't have a whole lot of interaction with home infusion, but it's just medications that people take when they're at home, like dialysis and stuff like that. Conclusion, experience is not necessary. Like I said, I was a preschool teacher before I started working here. So I know how to sing the ABCs and I knew how to interact with really small people, but I learned really quickly. I got a passion for it, and I think this is launching me into, you know, possibly becoming a pharmacist one day, and I can keep doing it. You know, I had to really pull back information that I learned in high school with this job. You do a lot of math, you do a lot of like measuring, you know, counting, algebra, make sure you can count by 5. That's important. Yeah. So like, just pay attention. You might not think you're going to need that information in high school, but you will, I promise. Mm-hmm. And yeah, this job's really great. It'll shape you for any job, whether you want to be a doctor, a nurse, a pharmacist, any healthcare career field you get experience in this job with. So yeah, that's all I got for that. I'm going to turn it to Lonnie.
All right. So I will take over from here. So I'm going to talk to you guys about what it is to become an inpatient pharmacy technician. Just a little bit about me. My name is Lonnie Schmiel, and I work currently at ProHealth Care in the pharmacy buyer role, which is an advanced technician role. I've been at ProHealth Care for 20 years. This coming August will be my 20-year anniversary. I started my career in retail, so I have always been in pharmacy my entire life. Since I was 14 years old, I started working in the gift shop portion of a pharmacy in northern Wisconsin, and then I moved over to the retail end of that, and then from there I kind of just, once I moved down here, I got a job in the inpatient world. I did attend the one-year certification program through Lakeshore Technical College. They offer their program, I think it's like a Webex type offering through all kinds of sites. So even though they're located, I think they're near Green Bay, you can take their program online at WCTC or wherever you may be. And then I've just advanced my career over the years with on-the-job training as opportunities have come up or arise. Wrong button. The education for an inpatient technician is the same as retail. It's a high school diploma. You do have the option of doing the one-year certificate program through Lakeshore Technical College. There might be other programs that you can take that might be some just straight online stuff, but that's one option. And then there is a certified, you become certified through the Pharmacy Technician Certification Board, otherwise known as the PTCB, and I have that information and the websites for that coming up in a few slides. For an inpatient technician, we are very heavily automated, which is unusual for an inpatient pharmacy. We have all of our inventory is housed in a carousel system, which I'll show you in a minute. All of our inventory on the floors is in an OmniCell, and I can see, as the buyer, I can see all of our inventory at the drop of a hat in our inventory system. So we're just kind of a little bit different than a lot of other area hospitals that we have. Actually, that's quite a luxury to have. We have our technicians answering the phones, triaging anything that a nurse may call down for, missing meds. They need new meds. They need IV bags for their next IV bag for a patient. Our technicians are doing IV compounding. So any bags, like if you've ever seen, even on TV, where you have a patient in a bed and all the IVs are hanging up, that is our technicians that make those bags. They're also delivering any of those medications that we make in the pharmacy or the orders we put together. We also do all the ordering. That's what I mainly do, is all the ordering and receiving for all of our inventory for inpatient. I actually do the buying for our 3 hospitals, Waukesha, Oconomowoc, and Mukwonago, and then all of the buying for our, I think we have 13 ProHealth Care clinics within Waukesha County. We kind of have our fingers all over the place, all over. And so this is just some pictures of our automation. This first top corner picture is a picture of a carousel that houses a majority of our inventory. It turns just kind of like a Ferris wheel and shows you what to pick and when and where. Then we have this picture, which is just the different types of OmniCells, which house all the inventory up on the floors. Some of them are for just the inpatient units. Some of these are specific for OR rooms in different procedural areas. We also use a system called KitCheck, where we label all of medications that would be in a crash cart or in different trays that we use. And then this machine can quickly read all of those RFID tags within seconds and tell you what you need to add, fill, or what's about to expire. Then we also use another system called Pharmacy Keeper, which you can see the technician that's all gowned up in the PPE using this iPad. They are taking pictures of all of their IVs every step by step. The pharmacist reviews all those steps and verifies the bag before they make it, so that we ensure that the bags are made accurately and that there wasn't any steps missed, and that they contain the proper medication. So there are a lot of opportunities for specialty roles and advancement within inpatient. There is in retail as well. Some of these that I have listed here are part of our retail team. So in inpatient pharmacy, I think we have tech level 1, 2, and 3, and that's pretty common through most hospitals. We have the opportunity for IV compounding, which is a higher level tech, lead tech, oncology tech, those are all very specialized. The MRS or medication reconciliation specialists are part of our retail team. They work closely with a lot of inpatient staff as well. We have the purchasing and receiving technicians. We have billing for our technicians. I think we have insurance prior authorization techs too that specialize and help with a lot of oncology coverage for medications. And then we also have a technician who is a supervisor over all of the inpatient technicians. So kind of a unique setup here. But ProHealth Care is very big on advancing staff and training and teaching and giving you opportunities to advance your growth as a pharmacy tech. Kind of what I highlighted before, becoming a tech, you are required to have a high school diploma or a GED. There is all on-the-job training and studying at home, as Amanda had talked about earlier. Inpatient, there is a lot of algebra kind of involved, where you're trying to figure out how many milligrams or milliliters of whatever it might be that you need to fill up or fill your IV bags with, just different tasks that require that. There is technical training programs through school and online training. ProHealth Care requires you to have your certification within the first 2 years of employment, and that certification is achieved by taking an exam through the Pharmacy Technician Certification Board, and you're required to have 2 years of continuing education. Or not, sorry, every 2 years you need to have continuing education completed. Do that a little better. And let's see. This ptcb.org/guidebook is a good resource to go and look at everything that you might want to know about what it looks like, what the study guide looks like, what the programs look like. There's just a lot of information on there about anybody who's interested in becoming a pharmacy technician. Kind of outlines all of the things that are on here. And you'll see on that website too, they offer advanced certifications as well. So there's a lot of opportunity there. And ProHealth Care does offer the opportunity, even I feel like we've had high school students come in just that might be interested to come in and shadow just to see what it really is all about. If it's something you want to come in and see, you can come in for a couple hours and see what it all entails. Kind of everything we have. I don't know if you guys have any questions.
Yeah, I'm not sure if they might not be able to ask questions. I don't know if Kelly's there to come off of mute if anybody has questions. Otherwise, you can always write them down or give them to Kelly too, and we can make sure we get those answered for you. I know it's hard when you're kind of watching this as a group, but if you also wouldn't mind, if you don't have questions or aren't able to share those, there is a QR code here. It's just a brief survey on today's presentation. Since we're really piloting these, we want to get your feedback as far as how you thought it went, what you want to see more of or less of. We will be offering this once per month through May. The next one is Wednesday, February 15th. We will have a registered nurse coming in to talk about her role. Right now, she's working in the recovery room, but she's worked in the ICU, day surgery, so she'll have a lot of experience and whatnot to share with you all. But again, hopefully you all learned something today. I know it's difficult when you're watching it as a group to kind of get your feedback right now, but if you wouldn't mind completing that survey, as I mentioned, and then registering for any upcoming programs of interest. We will have these recorded too, so even if you can't make one, be on the lookout. There's a flyer, hopefully you all saw, with the link to register for each of these that shows all of the dates and topics, and then you also will have the website where you can watch the recordings of this. So again, I don't know, Kelly, if you're there or not, but I just want to thank everyone for tuning in, and thank you so much, Lonnie and Amanda, for taking the time out of your busy schedules to present. And I think that's all we've got. Any other last comments from either of you that you'd like to make?
Yeah, when you talked about next week where you have a nurse coming in, I just wanted to add that a pharmacy tech position is really a good start to if you're interested in becoming a nurse or a pharmacist, or really any kind of program or anything that requires a degree within healthcare. Pharmacy technician really does give you a really good base and help to understand things outside of the pharmacy.
Awesome. Thanks so much. We appreciate your feedback. Have a great rest of your day, and we hope to see you next time.